I'll say greetings to everyone. I'm Dr. Brian Sims. I'm one of the senior medical advisors with the National Association of State Mental Health Program Directors, and it is my honor to be your host today for the 176th episode of the Crisis Jam. I am thrilled to be a part of this today, particularly pertaining to the topic, where there's going to be discussions of formative research for 988 messaging that's going to be given to us by Elizabeth Box a little bit later on. I absolutely am looking forward to this presentation, and I welcome all of you to the Crisis Jam for today. Next slide, please. In order to queue up so that we can get to that point, just a reminder to everyone that if you haven't already or you know someone who's not yet signed up, please have them, and the link will be placed in the box for talk.crisisnow.com. Once you go into that site, you are then able to register for the upcoming Crisis Jams. And as I mentioned times before, that once you have registered for the site, you will then be able to access a ton of material. And you'll also be able to go forward and backwards. You can actually go and look at what we found out to be at least around 140 prior episodes of the Crisis Jam, and information for all of you to be able to access. Next slide, please. This is also a testimony to say that as of this point, we have now nearly 500 unique speakers that have done so since its inception in 2020, have given their talks in the Crisis Jam. Albeit it may be almost 500, we are still looking for others to come in. So as the link is placed in the chat box, if you have any ideas or any thoughts about speakers that you would like to have added to this list, this unique list, we ask you to please place them in there. Next slide, please. Now, just a couple of notes on some news, the latest crisis news. One of the things was an article through the JAMA network that talked about caring letters sent by a clinician or peer to at-risk veterans. And this was particularly of importance because when we look at how our 988 line is set up and how there is a diversion number that takes you to veteran services, this was a very unique element. It was a clinical, randomized clinical trial that just took a look at caring letters being sent out by clinicians to veterans who were actually accessing the 988 line. Just something for everyone to read, very positive. Next slide, please. And here's another article, staying within the military perspectives from the FED Week, that talks about the Navy bolstering suicide prevention support under the development of the Brandon Act. And this was published just a few days back. So it's, again, showing that connection now that is enhancing those connections of veteran services and the community and behavioral health services. We're trying to make sure that those are strengthened so that resources are available on both sides. Next slide, please. Now, this is a webinar that is going to be scheduled, and it's actually scheduled for today. And it's going to be on the power of Asian American, Native Hawaiian, and Pacific Islander cultural practices and healing. This is something that you really don't want to miss. And just giving you an update that this will be today. And as you could see at the bottom of the screen there, 9 a.m. Hawaii time, but 12 p.m. Pacific and 3 p.m. Eastern. The link so that you can register for this will be placed in the box. Again, we have been looking a lot at national, but there's always been attention to the international components, particularly the Pacific Island aspects of delivery of care. They are such vitally important. And this is something we can all learn in terms of how we look at our cultures. And there will be a lot more coming up later about cultural aspects of delivery of care and the understanding of culture. Let's go to the next slide, please. All righty. Well, this has led us now to the hot seat, the crisis trivia hot seat for today. And again today, I don't know why, but we just don't seem to be able to garnish individuals who want to be in the hot seat. So as a result, we're going to use our amazing, outstanding audience, and we're going to have you guys be our trivia hot seat members today. So here is our question for today. It starts off with a header. Advocacy campaigns can be used to raise funds for programs such as the Global Fund supporting HIV and AIDS programs to bring widespread awareness of a critical topic, to spur policy changes, or to garner supporters. Now, with that information in mind, the question we have for you today: what advocacy campaign focuses on reducing stigma associated with mental health issues and was launched in 2010 by the British royal family? You see your four choices there. And I'm asking this amazing audience to continue to do what I know and have faith in you that you do. Select your answers and please submit them at this time. Give it a couple of minutes just to see how things turn out here. All righty. Well, here we have our results. And it seems that about half of you are really looking at B, or heads together, as your final answer. There's some spread amongst the red and the living strong, but let's see what the actual answer is. And the actual answer is heads together. So kudos to all of you that came up with that particular answer. And all I can give you at this point is kudos. But I can say to you that just think about this, jammers. As you have answered that question correctly, maybe you want to think about actually being one of our hot seat members. Give it a shot. There's a t-shirt or a hat or otherwise in it for you if you do. Heads Together is a mental health initiative that was spearheaded by the Duke and Duchess of Cambridge and Prince Harry, and aimed to promote open conversations about mental health and provide support for those affected by mental health issues. This is such a huge issue with regards to communication and is very theme-oriented to our discussions today. So it helps us to take a look at not just what's happening here in the US, but how movements of a similar sense have moved towards our goals of looking at 988 and its implementation across the spectrums. So let's go to our next slide, please. So at this point, it is my distinct pleasure to introduce to you all our featured presentation for today. And our featured presenter is Elizabeth Box. And Elizabeth Box is the project director of 988 Formative Research Project and senior advisor for the National Action Alliance for Suicide Prevention at the Education Development Center. I've been waiting for this particular talk, and I am so thrilled to introduce you, Elizabeth. And at this juncture, you can take it from here. So welcome, and thank you for coming.
Thank you. Thank you so much, Dr. Sims, and thank you, everybody, for letting us come to this community and talk about our research project. Like Dr. Sims said, my name's Elizabeth Box. I also go by Liz. Either is fine with me. My pronouns are she, her. And I have the privilege of being the project director for the Formative Research Project, which was a collaborative effort between the National Action Alliance for Suicide Prevention and our partners at the Suicide Prevention Resource Center and our esteemed research partners, the Ad Council. And it was supported by SAMHSA. And so I'm so excited to tell you a little bit more about the project today. Just full disclosure, there is so much data. There are so many findings from this research that we won't have time to get into all of it. But what we wanted to do today is just share a little bit of the kind of findings and the kind of data that is available to all of you right now about messaging and communications around 988. And before I jump into that, if you don't mind going to the next slide, please. I just want to start off with a land acknowledgement that we have borrowed from our partners at SPRC. We acknowledge that the land that now makes up the United States of America was the traditional home, hunting ground, trade exchange point, and migration route of more than 574 American Indian and Alaska Native federally recognized tribes, and many more tribal nations that are not federally recognized or no longer exist. We recognize the cruel legacy of slavery and colonialism in our nation and acknowledge the people whose labor was exploited for generations to help establish the economy of the United States. We honor Indigenous, enslaved, and immigrant peoples' resilience, labor, and stewardship of the land, and commit to creating a future founded on respect, justice, and inclusion for all people as we work to heal the deepest generational wounds. And this land acknowledgement is something that we begin all of our presentations on this project with, because the concept of centering around groups of people that have historically been on the margins is central to this project. As we talk about the populations that were included in this research, it was very important to the project that we were including voices with suicide-centered lived experience, people who have worked and lived and served the communities that we've been talking about. This concept of inclusion and centering on the margins has just sort of moved through the project throughout the last 2 years we've been working on it. Next slide, please. So for those of you who would like to see this on your mobile device, you can scan this QR code. It'll take you right to our webpage. My colleagues have also just dropped in the chat. Everything we're going to talk about here today is available on the website right now. You won't hurt our feelings if you're scanning and skimming through these research materials as we're presenting today. Go and get it, it's yours. Next slide, please. I want to share just a little bit of background about what formative research is and why 988 specific formative research is so important. Formative research is a type of research that generally is done at the beginning of a program, a communications campaign. You do it at the start of any kind of initiative, and it's really to understand how you can best reach your key audiences. And in this case, for 988, this was really important for us to understand so that we could better support culturally sensitive, responsive, effective, and ultimately successful 988 communications. It provides insights that help make informed decisions. And so for us, one of the major goals that we were seeking insights around was, how do we raise awareness? How do communicators, how do all of you who are communicating and messaging in this space raise awareness of and instill trust in 988? In particular, among those populations that have been disproportionately impacted by suicide, well as their trusted messengers. And I'll talk a little bit about what we mean when we say trusted messengers in just a second. And then what we also gained from 988 specific formative research are evidence-based message frames that can be tested, validated, and enhanced through additional message testing and research. And message frames are, they're a story-based way of understanding, of explaining, of describing a concept or a service or a product, in this case, 988. And so what this research was, it helped us understand those messaging frames that were most resonant with our key audiences. Next slide, please. So our research study, it is actually comprised of two different studies that have been, we started this project in summer of 2022. So we've been now, as we wrap up, it's been about 2 years in the making. The first study focused on 8 populations that were disproportionately impacted by suicide. You can see those groups on your screen, but for those who maybe can't read them, I'll read them to you. American Indian and Alaska Native youth and young adults. And when I say youth and young adults, I mean people ages 13 to 34. Asian American, Native Hawaiian, and Pacific Islander youth and young adults, Black youth and young adults, Hispanic youth and young adults, individuals who have attempted suicide or experienced serious thoughts of suicide during their lifetime, ages 18 and up, LGBTQIA+ youth and adults, that's people ages 13 to 49, people with disabilities, ages 13 and up, and rural older men, ages 49 and up. And so from that first study, we learned a lot of things, but one of the things we learned is who are those trusted messengers? Who are the people that in a time of crisis or when navigating a difficult health situation, mental health situation, who would you turn to for unbiased and trusted support and guidance? And you can see in the research study what each of these groups said, but by and large, the commonality of who those trusted messengers were to these 8 groups were familial and friend connections. And so we took those 4 groups of people that kept rising to the top: mothers and caregivers, spouses and partners, siblings and friends, and we conducted another study with those trusted messengers. And so that research is brand spanking new. We just released it last week, actually, about a week ago, hot off the presses. And it really builds on the first study, which was released in November 2023. And so taken together, understanding not only the populations disproportionately impacted by suicide, but also the people that they trust the most, those nudgers, those helpers in their lives, really creates a rich foundation of understanding for a comprehensive, holistic communications where you can message not only to the people who maybe need the support from 988, who we want to encourage to reach out for 988 to help with their own mental health challenges, but those helpers, those trusted nudge givers in their life. And I want to just add that one of the most valuable parts of this project for me, and I'll speak on behalf of the whole project team, is that as we were doing this research, as we were conducting this project, we had the great benefit of working with groups of people that we called guidance panels. And so for each of our 8 populations that you see there on the left, we had a handful of advisors who basically walked alongside us as we went through the research, who reflected and represented those populations that we were conducting research on. And they provided insights, they provided feedback, they added valuable context and interpretation to some of the research findings. And we couldn't have done it without them. And many of them also had suicide-centered lived experience. And so if any of those folks are on this, I just want to say a big thank you to all of our guidance panel members, and especially those who walked with us all the way through to trusted messengers. Next slide, please. So like I said at the beginning, we just simply don't have enough time to go into the details of what we found in the report, but I wanted to share just a little bit of the categories, the areas of findings. We explored mental health struggles and crisis. We asked for both of our populations disproportionately impacted by suicide, as well as their trusted messengers, to help explain and help understand their mental health journey, whether that was for themselves or supporting somebody who was going through a mental health crisis or struggle. We asked our disproportionately impacted populations about their experiences with suicidal ideation, and we found some pretty interesting things there, to include the way that they talked about their own suicidal ideation and what that felt and sounded like to them. We talked about 988, knowledge, use, and intentions, including if they would recommend 988 and why or why not. We also tested messages about 988. And so this is where we looked at those message frames. And that included foundational message frames, which are sort of the starting point, the way of describing what 988 is. It also included conditional message frames, which are designed to address specific barriers that we had heard from our study participants. And we attempted to use messaging to overcome some of those barriers. So some really interesting findings related to those message frames. And then, as I mentioned, we also asked about trusted messengers to the populations disproportionately impacted by suicide, which again is how we ended up with the groups for our second study. But I want to encourage you to go look at that section because you'll see other trusted messengers include mental health organizations, mental health professionals, and so that to us signals that there's a huge role for crisis centers, for mental health advocacy organizations to play in this communications realm. Next slide, please. One of the assets of this project is we produce toolkits, and the toolkits are actionable. They provide actionable insights about how somebody, who is communicating about 988, whether you're a copywriter or a campaign designer or a strategist, or maybe you're in charge of your social media content for your crisis center. How anybody who is communicating about 988 can use language to better resonate with these target audiences. And so I wanted to share just a couple messaging principles that rang true across both studies. Now, again, each study, each population has its own nuances. So please go and look at the toolkits, take a read through the studies, because if you don't, you'll miss a lot of the rich nuance among these different populations. But the principles that really rang true across both are that people really liked and resonated with 988 being available 24/7, that it was free, and that it was anonymous and confidential. They also really liked the messages around trained counselors who could help and who cared. It didn't matter so much what kind of degree they had or what level of credential it was. They wanted to talk to somebody who cared and who was going to be able to help them in that moment, whatever that looked like. The foundational messaging frames performed really well across both of our populations disproportionately impacted by suicide, as well as their trusted messengers. And so as communicators, those foundational message frames are an excellent starting point for anybody who's developing messages about 988. The conditional frames also performed well, so use those to follow up in communications to address specific barriers. And then lastly, there's lots of opportunity to provide deeper resources about 988, and our study participants gave us clues about what they're seeking. So things like who to contact and when and how for different types of mental health challenges, general information about mental health. So if somebody's having a panic attack or issues sleeping, what do you do? What is some general information about that? Success stories. So examples of people successfully contacting 988 and getting the help that they needed. What happens when someone calls? What does that look like? What is that experience? And then more information about the counselor's training. How do I know that if I call, I'm going to talk to somebody who can really understand me, but also is able and competent to help? Next slide, please. So again, at the link in the chat, it's 988messaging.org/research. You can access all of the resources from this project. There are kinds of reports for both studies. There's a number of toolkits. So we have main toolkits for each of the studies, but then we also have individual toolkits for each of those 8 populations disproportionately impacted by suicide. So if you are communicating or working directly with older rural men, there is a dedicated toolkit for that. If you are working with Black youth and young adults, there is a toolkit for that. Check them out. They're great, easy to use. And then for any of our research friends on the call, we've also provided the research protocols for each study. So if you have questions about the methodology, how the research was conducted, if you want to replicate it, if you'd like to take things like our survey instruments, our research tools, all of this is available on the website. We're in the process of posting the research protocol for trusted messengers. So that one's not quite there yet, but it will be there soon. But that's where you can access it. Again, at our website, 988messaging.org/research. Next slide, please. If you have questions, you're welcome to contact me, ebox@edc.org. I also just want to thank everybody on this call who is already doing amazing work in the communication sphere. Whether that is on a big public platform or in your own day-to-day interpersonal communications. Thank you for being trusted and confident messengers around 988. I hope this research is helpful. And I'm also delighted that we have some members of our project team, Derek Feldman and Carissa Pallas, who will join us for the roundtable. So I'm going to pass it back to Dr. Sims. Thank you so much.
Wow, Elizabeth, first and foremost, thank you. Thank you. I recognized from the beginning that you had a huge challenge ahead of you in terms of presenting the information. But thank you for that information because it did spark some questions. And before I even go to Carissa or Derek, I just wanted to ask a question, if you would. Going back to the beginning, what I loved about what you said initially was that you went in first with research in mind to talk to them before anything was implemented so that you could get the buy-in. I'm curious if there was any challenges or resistance that you saw in the beginning when it was presented.
Yeah, I mean, I think a major challenge is that just from a timing perspective, we started this research in summer of 2022, which was when 988 was launching, right? And so there was a need to be communicating about 988 in absence of having good research and data about how to communicate about 988. And so through the support of many of the same project team members, SAMHSA, Ad Council, SPRC, a precursor to the research was the development of the 988 messaging framework, which really provided kind of like a stepwise way for communicators to help fill in the gaps and make informed decisions about how to message safely and effectively about 988, even though we didn't have the data in hand. So that was probably the biggest challenge, is just that, we're trying to do this research. The service is brand new. Awareness initially was low. But I think there was broad recognition that the research was important and it was important to do it right and not rush it. And so I think the inclusion of the populations that ended up in study was a very deliberate, it was important for us to move at the pace we needed to make sure we were being inclusive and getting all the right data that we needed.
Wow. And the word that I didn't necessarily hear, but resonated with me was the degree of transparency, of really just going in and being open about what it is that you're offering. I can't imagine that would do anything other than enhance the trust that people would have in at least giving information and cooperating within the service. So excellent. Thank you. Thank you so much. So I'm going to move at this point to our roundtable discussion, and we're going to begin with Carissa Pallas, Division Director of Communications for 988 and Behavioral Health Crisis Coordinating Office out of SAMHSA. And Carissa, your comments, please.
Hi, everyone. Good afternoon. Thank you so much, Liz. I just want to say I can't even express with words how helpful this 988 and how essential this 988 formative research has been to us developing messaging that we think will be able to resonate with the people we're trying to reach about 988. Learning how they talk about their own mental health issues, or how they think about 988 now, and if they even know about it. If they do know about it, do they understand? What are they worried about? All of those were such important questions for us to understand how to talk to them about 988, the way that they're already thinking about 988, or the way they're already thinking about mental health. Liz is right in that we had to sort of go out with 988 before we knew how best to talk about it. And that was difficult, right? I've only been with a team since June, so it's been about a year now. But I will say we did it okay. The message framing group was really helpful for us, but we have made several adjustments to our messaging based on the findings that were released in November. And then we'll also be using the findings that have just been released last week with the trusted messengers as well, because those trusted messengers are so important, right? I mean, they're the people we're trying to reach. The people who are in their lives need to also be able to know and trust 988 and understand that they can use it along with the people who they love and who are trying to find help. I will say the message framing that resonated and motivated the collective group, that 24/7 availability, the anonymity, the quick to connect, not feeling judged, knowing they're going to communicate with a real person who cares and is trained to help. Those are pieces that we've pulled into our messaging. You may have seen those changes appear throughout the year on our messaging toolkit, but we're also working on a paid media marketing. And so we've been creating specific messaging around, okay, how do we show them what happens when you call? How do we get some counselors sort of talking so we can record those things and show them exactly like who is on the other side? How do we make it clear that it's a judgment-free zone? So we've got some ads now that we're working on that are being tested with the same market, the same audiences who the formative research was done with, that and when it's resonating with them, which we're not surprised by because of the formative research findings, are things like taglines like "no judgment, just help," "you are not alone," "you matter," "you don't have to say your name or where you're from to get help." Those kind of things have been really resonant so far with our testing groups. So I just can't say enough how much the formative research has helped us. We hope that this is going to be a springboard that lots of different groups can use to further this research with more audience groups. I'd love to see a deeper dive into what would resonate with older rural men. I'd love to see some substance use research that is also within this vein of 988 and how to talk about that with folks. We are finding in our testing that this audience group is interested in that. You know, where do I go for help with that too? And does 988 help with that? So I'm just really looking forward to the next phases of this when we're able to do it. And I can't say enough about how this has helped us form our messaging now and given us direction that we wouldn't have had otherwise, that was really necessary for us to even know where to start.
And thank you, Carissa. Very comprehensive, but also very forward-thinking. I mean, this is what I love about SAMHSA's vision in terms of where 988 is. They're not stamping it. They're looking ahead and saying, these are the things you'd like to see develop, but they're doing it also in collaboration with those that are working within the realm so that you can get that vital data that you need in order to move forward. That is so wonderful to hear. I am going to move over now to Derek Feldman, who's the Managing Director of the Ad Council Research Institute. And Derek, welcome, and your comments, please.
Thank you so much for having me. And it's been a complete honor and pleasure to work on this project with colleagues that have already spoken, Carissa and Liz and all of the teams. You know, I would say a couple of things that were really important during the research design, which is something you'll find both in the report, but also a lot of the application in the toolkits. And we do this a lot here at the Ad Council, which is how do we work with people that we are trying to communicate most with to help us develop the messaging. That was a really key principle, because we can all sit in a room and say, this is what we should message based upon our own perceptions or attitudes or what we think everybody should know. And what's really great here is that throughout each of the research phases, we really spent time with our audiences, all of the audiences that Liz had mentioned. And we put messaging in front of them to react, to test it, to optimize it, to help us change it, make it better. And we would come round after round with new messaging that really is their messages, communicating to people just like them, which is really great, which is why we saw such a positive resonance with a lot of the messaging during testing in general. So I highly recommend that you take a look at some of the messaging in both the toolkits and the report to see how our populations help to craft them. It was all about that centered approach that Liz mentioned, and we carried that through with all of our message testing. The other thing that's quite interesting about that, and you mentioned transparency, Brian, and one of the things I would say is that we shared with you our initial messaging and at each phase how it performed and what didn't work. So you can see it all. So you can see, how we were learning along the way in general. One other thing that was really key for us, and here at the Ad Council, obviously, we focus nationwide on a lot of social issues and work, and mental health is an important pillar of work. We work with SIMSA and CDC and many others on a broad range of topics. And as we look at this, we had to ensure that we had as much of a sample of our populations that really need to hear this kind of communication. Our first study, we had about 5,000 participants participate, actually a little over that. This trusted messengers. So people, loved ones, close connections to people who are disproportionately impacted by suicide. We had almost 13,000 participating in our study, right? That lived experience and that close connection. So what's really great about that is we are really able to look at the data from various angles. And when you look at the toolkits, you'll see, based upon all kinds of demographics or characteristics, how individuals responded. So that gives a sense, it's really an actionable toolkit for you to take a look at. But the strength of the study is not only in our ability to let our target audience help define the message with us and for us, but also that we hear as many voices as possible in the study. And that was very, very key.
Derek, again, thank you. Thank you for providing that information. And I can tell you, as you both were speaking, both you and Carissa, messages began to pop up into the chat box. I think what we'll do for just a few moments, if you would, is maybe review back and take a look at some of the questions that came up. And what I'll do, if you don't mind, Elizabeth, I'll throw it at you and you can let us know who you think might be able to answer it a little bit more explicitly. But one of the questions that came up talks about early 988 planning and development meetings with 911 community. They said that the 911 veterans made clear that full adoption of this kind of service requires a massive national commitment. And they're asking, is there a plan for a major national commitment for 988 messaging? And if so, when that may or may not occur. So I guess we'll start with that.
Yeah, I'm happy to address that. And then there was a second question after that that is along the same lines of about the campaign. I wanted to do a little bit of level setting in here anyway, because yes, we would love to do a full-blown national behavior change type campaign for 988. We don't quite have the funding for that to happen yet. Hopefully in the future that will be able to happen. And when it does, it'll be a fully collaborative effort with an advisory group and all of the regular things that sort of large scale campaign would require. What we do have right now is an opportunity to get some ads out into the paid market for certain audiences. Those are not geographically, they're not by geographic location, but by audience and where they are. So we're talking basically about social media ads, ads on apps where people are, maybe gaming areas, podcasts, things like that. So those are the things we're working on now. We are hoping to have, we are working on putting some information out for Pride Month. So the LGBTQI plus audience will be receiving some messaging this month And we are announcing that this week. And we'll be sharing that with all of our partners and everybody who needs to know. But there will not be this, I think some people think of a national 90-day campaign as everybody all at once is going to have knowledge of 988, and it's going to cause a really big influx all at once. But we're really purposefully starting very slowly on our paid marketing, so we can make sure that 988 can handle it, and that we are constantly monitoring that and letting everybody know as we add more and more paid marketing on top of that throughout the summer, that you know exactly when that's going to be happening. So please stay tuned for that. We'll have an announcement coming soon, and we'll have a web page up where anybody can come and check on what's happening at any time.
Well, Carissa, thank you so much for that response. And I do want to thank all three of you. Definitely, Elizabeth, thank you so much for the presentation. Thank you, Carissa, for the roundtable, and Derek as well for the roundtable. Very engaging. I apologize that we weren't able to get to all of the questions in the chat box, but rest assured we will get some answers out for those who have placed them in there. But thank you all again for a wonderful discussion. And let's move on to our next area. And we're going to actually turn around and ask for Carissa if she'll come back again and give us the SAMHSA updates for today. Go ahead, Carissa.
Yes, I only have one update for today, and most of you probably have already seen this, but just in case you haven't, the FCC did post the proposed rule to require wireless carriers to implement one or more geo-routing solutions for calls to 988. And they're also seeking comment on a variety of issues related to the implementation of that geo-routing solution for wireless calls, non-wireless calls, and text messages to 988. The comments are due before June 28th, and reply comments are due on or before July 29th. And I can add that link to the Federal Register in the chat. That is all I have for today.
Well, thank you so much. And again, as I'm looking at all this, more things are coming into the chat box. Maybe we'll have some time to bring up a couple of them. But let's go ahead and move next to our NASPID update. And this will be given to us by our Executive Director of NASPID, Dr. Brian Hepburn. So, Brian, if you're available.
Thank you, Brian.
Mm-hmm.
Yeah, and thank you, Teresa, for that FCC information. I think this is really important, and I think people were very concerned that it may identify where the individual is specifically located, but the geo-routing just indicates where the individual generally is, so that instead of being identified by an area code, which could mean that you're in a different part of the country, this really helps you to know that the individual is in a certain part of the country, although not a specific address. So we think this is really exciting. So thank you for that information. Wanted to really thank Elizabeth, and also thank Teresa and Derek for their information. This is really exciting. We're at a nice point for 988. We're a couple of years out. We know that we're not ready to accommodate everybody who may need services, but we're ready to move ahead, and this marketing issue is very important. So thank you, and thank you to the National Action Alliance for Suicide Prevention, SBRC, the Ad Council, and of course, SAMHSA. We do have some good state examples of how states are moving ahead with marketing and messaging. I think a good example was in Chicago when Assistant Secretary Miriam Delphin-Rittman threw out the first pitch at the Chicago White Sox game in order to promote 988. And I believe it's today that Commissioner Kevin Tanner from Georgia will be throwing out the first pitch at the Atlanta Braves game in order to highlight 988. We also have state examples of 988 commercials. Tennessee has a number of promotional commercials on YouTube And there are a number of other states that have public service announcements, Ohio, Oklahoma, and Indiana. And those are all available for you to see. Dave Catalano from Nashville will put the various links on the chat, so you'll have access to them. But thank you very much for this, and I send it back to you, Brian. Thank you.
And thank you, Brian, as always. And yes, if you check your chat box, you'll see that those links have been placed in already. So wonderful. So we are now ready to move over to our federal updates. And we're going to ask Sarah Corcoran if she'll come on and provide us with the updates.
Thank you so much. Okay, if we can switch to the next slide, I will give a quick appropriations update as we are now really kicking off the FY 2025 appropriations process. A couple weeks ago, the House announced their appropriations markup schedule. In the subcommittee that deals specifically with SAMHSA and HHS, that is the Labor, Health and Human Services and Education's subcommittee. They plan to do their subcommittee markup on June 27th, and then the full committee markup on Wednesday, July 10th. So it's a pretty quick schedule. These are among the later of the markups that they've announced. Moving over to the right-hand side here, the subcommittee spending caps, also known as 302Bs for the policy nerds here on the call. That really sets what that spending cap is for each individual subcommittee. And last year, just a reminder of what the final bill ended up at for Labor, HHS, and Department of Education, that was $222.2 billion. This year, the House proposed cap for that same bill would be $184.6 billion, which is obviously quite a bit lower. Just setting a little bit of context here, kind of at the bottom square, is looking back at the proposed FY24 House bill. That was only at $147 billion, and we still ended up with our final numbers at $222 billion. So just putting out there that while these numbers are important to see what the House is thinking, they are by far not the final numbers. And the Senate will likely come in a lot closer to what we've had the past 2 fiscal years. And also our final bit of context here, SAMHSA still saw a small increase last year, despite an overall small cut in that bill from FY23. So we are still expecting, hopefully, strong SAMHSA and HHS final funding numbers, but this is just part of the process as they kick off the FY25 schedule. I'm going to turn it to Joanna for a quick Senate appropriations update. Thank you.
Yeah, so we don't have dates yet for the Senate, but we're expecting dates for July. So we're going to keep an eye on that and update you all when we get that. Things have been moving slowly in terms of getting any news, but once we get the news, everything seems to happen quickly. So we will keep everyone updated and look forward to that. Thanks, Sarah.
Wow, folks, thank you both for a very comprehensive overview. It really does help us to have this data available to us. And I'm so thankful when you bring it to us each week, because it really keeps us at the cusp of understanding what is going on from week to week and from this day by day and hour by hour. So thank you so much for that. We're now going to move to our next portion, and it's our crisis talk. And I'm going to ask Stephanie Hepburn if she will come forward and go ahead and get started, please.
Thanks, Dr. Sims. So I'd like to introduce Hafiza Mohammed. She's the CEO and founder of Backpack Healthcare. Hafiza, can you share why you started Backpack Healthcare, what the impetus was?
Yeah, I started Backpack in October of 2020. My son, who was 6, came to me and told me that he wanted to kill himself. My heart broke. I didn't see it coming. I was an executive for a large mental health company, and I struggled to find care for my son. But I was also embarrassed as a mom because I also wanted to find resources that I can help support my son without letting anyone know. And when I struggled to find that, I left and I started Backpack Healthcare.
So we talked about how you've incorporated AI. Can you chat with the participants a little bit about what that looks like? I know it's grown along since you launched in 2021.
Yeah, absolutely. So when I launched Backpack, I'm not a clinician by trade at all, but I'm a mom and I have a lot of empathy. And when I saw looking at the therapist burnout, I was surprised to see the individuals who are taking care of my son or those around them are getting burned out. And because I also had a tech background, I said, like, what are some of the things that they're struggling with that we can help reduce some of the burden so that they're not struggling as much with administrative tasks. So one thing that we created was called like a patient treatment plan generator. It was taking our therapist an average of 45 minutes every intake to create a treatment plan. And it was taken away from their interaction. So we gathered all of the information from their treatment plan and we automated it where we take information from their assessments that got 7 PHQ-9. And now we can generate a treatment plan within 10 seconds. And they can spend that time editing that treatment plan with the patient versus taking all of that time to document after their session. It makes it more easier for them. And we continue to work on other things to help ensure that we're reducing their stress and their burnout. My dream one day is that they show up for a session and all they do is talk to a patient and all the administrative burden is all automated. And we're close to that. We're 1 year away from that, but this is like my dream and this is how we're using AI.
I thought it was also very cool that the app that you created very soon is going to, when the kids are expressing their mood and they're playing the games on the app, that feedback is going to very soon go to the therapist and actually help to connect the child to the best fit therapist.
Yeah, absolutely. So currently, we have done more than 20,000 sessions and we have a large clinical team, all W-2s, by the way. So I just like to shout out that we want to make sure everyone has a stable income to support these kids. So yes, so we collect that information because every time I notice my son has sessions every week, the therapist would ask him, what happened during the week? How were you feeling? But it depended on what he was feeling at that very moment. So this information helps capture things that they're interacting it with throughout the week, doing bibliotherapy. So the therapist gets that information and are able to provide more context and more insights into how they're feeling, what happened. They can touch base about maybe you were in a bad mood on Monday, what happened, to really help support my son. So I like to talk about it from a mom's perspective, even though I'm a CEO, as to why these things are important. And also it can help identify if a child is escalating in symptoms or need help so that we can interact and get involved right away before they wait for that week session to happen. So those are some things that we have put in place within our app.
That's so cool. Well, thank you so much for hopping on with me. I'll pass it back to you, Dr. Sims. Thank you, Hafiza.
Thank you for having me.
If I could intervene before she disappears, Steph, if you're still there.
I'm still here. Yeah.
I just wanted to let you both know a lot of the positive comments that are coming into the chat box, particularly emphasizing what Hafiza has been talking about in terms of the front door and how important it is, because we've talked about this for many years when we talk about trauma-informed care and how to get information that's built on prevention, but it's also about early intervention. What are you doing in the beginning to prevent something from happening down the line? So there's a lot of interest in there, and I'm happy to see that she did put in the web address for it. But I just wanted to really acknowledge that there's a lot of interest, and I'm sure she'll be hearing a lot more. So thank you, Stephanie, for bringing her on, but also just to have her express about some of the struggles and how she's come up with this wonderful way to address it. I think will be something we'll be looking at.
Thank you, Dr. Sims. I think also what's cool is Hafiza goes into, supporting families and really it came out of her own experience, but helping families navigate tools, skills so that they can support their children and that it's not just the child themselves, it's the child and the family and how can we support children navigating their struggles and how to amplify that with AI. It's really fascinating. She also talks about insurance and how she's managed to get insurance on board, which is definitely worth participants taking a look at.
Oh, absolutely. Absolutely. That is wonderful. But again, thank you so much, Stephanie, and thanks again to Lisa.
Thank you so much.
I think we can see the overarching connected themes of everything that we talked about today. I'm wondering if we still have, Elizabeth, I don't know if you're still available. If so, if you could pop back in for a second.
Yes, I'm here.
Well, I appreciate that. I wanted to ask a question of you guys. There was a question that was posted in the box that I wanted to go back to refer to. And as soon as I find it, I'll be happy to share it with you. But they, the question was about another group that was potentially disproportionately affected by suicide. And I wanted to come back to that. And they were talking about, in this case, neurodiverse groups with autistic individuals, those with ADHD. So we're asking if there were any thoughts about maybe moving some of the messaging for those groups.
Yeah, no, absolutely. I appreciate the question, and just an acknowledgement that when we started this research, we knew that we were not going to be able to include all groups that are disproportionately impacted. Unfortunately, budget timelines are, real constraints on research projects, any project. And so one of the things that was really important to us is that we provided all of the research tools and instruments so that anybody that wanted to take these this structure of research could take those tools and instruments and apply them to other populations. And so, other groups that we talked about and ultimately were unable to include were groups like people with serious mental illness is one that we know are disproportionately impacted, people who had recently transitioned out of incarceration, people who are experiencing homelessness. And so we recognize both that we weren't able to get everybody. We've provided the research instruments so that anybody who wants to replicate it among different groups could. But we also recognize that the type of research we did may not be the best fit for some of these populations. Just the logistics and mechanics of completing research in the vein that we did may not work for all these groups. And so to have actual tailored, responsive research methods may need something different. And I don't know if Derek is still on, but he may want to add a little bit of commentary to that. He might have dropped, so apologies if I'm putting him on the spot if he's not here at all. But I hope that answers the question.
No, I think that the first thing that you said was recognizing that there are a number of groups, not just neurodiverse, but also a number of other groups that couldn't possibly be put into the whole realm there. So that's understandable. But the thought of being there and actually designing it is still very well addressed. Thanks. I think that was perfect response. All righty. Well, thank you again for everything that you've done and your participation today. And I want to thank everyone else for being a part of this wonderful, wonderful crisis jam. So let's go to the next slide, please. And this, as we draw towards a close for today, I just wanted to go forward with letting you know how the next several weeks are going to happen. Just stay tuned for episode 177 of the 988 Crisis Jam, which will be about crisis continuum and MCT services. And before I go to the next one, there was a reminder put in the chat box and I want you guys to reference. When we are ready to go through the next couple of weeks, there's going to be some changes. So let's first of all go to the next slide. This is not a shameless plug, but in 2 weeks, I'll be doing a presentation on acceptance of crisis services by marginalized populations. But happy to have you guys on board during that time. And just afterwards, we will be getting, that will be on June 12th. So June 19th, we will not have a crisis jam. Also, on June the 26th, there will also not be a crisis jam. And the reason why we're not having a crisis jam on the 26th, on the 19th, is because of Juneteenth. And then on the 26th, we're not having it because there's a summit in Amsterdam called the Crisis Now 3 Summit in Amsterdam. and there'll be a lot of people in that particular venue. So we're not going to have the crisis jam during that week too. And as a reminder that for those that are interested, there are only a few spots left in that summit. So please, if you are interested, join in and attach for it. It's June 29th and 30th of this year. And at this point, I want to say thank you all for watching this 988 Crisis Jam. It's been wonderful. I look forward to future ones, and everyone have a wonderful rest of your day, and we'll see you next time.